Good afternoon, everyone, and welcome to today's Mental Health TeleTalk, how brands are responding to COVID-19, flattening our mental health curve. I'm Elise Cohen, Senior Director of Food, Health, and Wellness Programs at the Chamber of Commerce Foundation. And every day I get to work with companies around the world to help them build and share their employee and social impact initiatives that focus on improving well-being and inclusion for all. Amidst the social isolation and uncertainties in health and economic impacts, one thing is certain: how we as individuals, caretakers, and employers, and as a global community take care of ourselves and others truly matters. In the Chamber Foundation's recent case study report, Cultivating Wellness in the Workplace, we highlighted how business leaders are stepping up to address mental health and well-being in more innovative and profound ways than ever before. And our partners on today's call are no exception. They have been leading these efforts long before the COVID-19 pandemic. But the pandemic and the resulting economic downturn have negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. To address what's now seen as the next pandemic, brands have stepped up even more to create and strengthen innovative partnerships designed to support employees, frontline workers, and other vulnerable populations. Joining me today is Taryn Bird, Director of Social Impact at Kate Spade New York, Maggie Arrow, Head of Social Impact at Harry's Men's Care brand, and Nancy Lublin, Founder and CEO of the Crisis Text Line. These companies and organizations have been working alongside one another for several years, and I'm honored to have the opportunity to bring them all together today. Before I get started, I just want to go over a couple of housekeeping points. Our webinar today will be broken down into 3 segments: brief speaker introductions, panelist discussion, and audience Q&A. All participants are muted, but you can submit your questions through the GoToWebinar's chat feature, and I encourage you to do so as soon as they come to mind. I promise we'll get to as many questions as possible before we wrap today's call at 3 p.m. Finally, today's presentation will be recorded and archived on the Chamber Foundation's Mental Health TeleTalk webpage, alongside all previous virtual events. We will share the link to view this online as part of the post-event follow-up as well. So with that, let's get started. I'd like to start by having each of our panelists introduce themselves and their work and the mission of their organization. And I'd like you to talk as if you were in a conversation with a close friend over coffee or a drink. I'll start with you, Nancy.
Introduce myself. I can't even imagine having coffee or a drink with you right now. So I'd be wearing a mask and you'd be 6 feet apart. So I'm Nancy. I'm the co-founder and CEO of Crisis Text Line, which is 24/7 mental health support at your fingertips. And as you can imagine, it has been a busy 2 months, and we expect that after the virus is curtailed or crushed, the mental health scar is going to last a lot longer.
Thank you. Taryn.
Sure. Well, I'm gonna riff off of what Nancy was saying. So I got my mask on and I'm sipping on a good mocktail, particularly one with cucumber. It's some kind of tonic. My name's Taryn Bird. I'm the Director of Social Impact at Kate Spade New York. My job entails leading our social impact work, which encompasses and is focused in empowering women and girls to be the heroines of their own stories. And mental health and the mental well-being of women and girls is truly at the center and at the heart of our social impact work, both domestically and globally. I've been at the company for about 7 years, and you know, I definitely feel like you know, our work in the women and girls empowerment space has definitely evolved over the last few years with an increase in the mental health space. And I'm really jazzed to be here with you guys to chat about that, what that journey's been like, why we made the decisions that we did, and why we feel like this topic is so particularly relevant for women and girls around the world.
Thanks, Taryn. Last but not least, Maggie.
Hey y'all, my name is Maggie Arrow. I'm head of social impact at Harry's. Harry's, you all might know, is a men's grooming company. We also have a women's brand called Flamingo. And I lead social impact for those two brands and any upcoming brands that we'll launch in the next couple of years too, which is really exciting. I think if I were talking to a friend about the type of work that I do, if you boil it down, I think I have the best job at Harry's. What I do, and I tell this to Jeff and Andy, who are co-founders, all the time, it's no secret. I just get to think all day long about how we can do better in the world and better as a company. And yeah, I truly think it's the best job. For Harry's in particular, we have a focus on men's mental health. We launched a little bit over a year ago. And we announced a goal that will reach 500,000 men in the next couple of years, which to us will be in January 2021. So what I get to do all day long is find the rock star nonprofit organizations like Crisis Text Line and a bunch of others to help us reach that goal. And yeah, if candidly we were like having a drink, I'd probably also make some sort of like snarky remark about specializing men and mental health and feeling like neither, I struggle with both my personal life. But you know,
I second that.
yeah, totally. I'm not an expert in my personal life or my professional life, but we'll talk about that later.
That's funny.
Awesome. Well, thanks for being so honest in your introductions. So I want to start, Nancy, I think I'll start with you here. I'd love for you to share a little bit about what you've been seeing in terms of the data and usage of Crisis Text Line since COVID started. And for Kate Spade, Taryn, and Maggie, for you, certainly if you have anything to share in terms of data and usage, or viewership of a lot of the stuff that you've been talking about in your messages, by all means, we'd love to hear that as well. But Nancy, I'll start with you.
So we've seen more volume, and it's been different volume. So more volume on average, we're up about 40%. Different volume, we've seen different people, different kinds of people, different demographics, and different kinds of issues. So let's start with issues. The first wave of things that we saw was anxiety. Just a wave of anxiety about, at the time it was really being called coronavirus, about symptoms, using words like panic and freaked out. That was the first wave. The second wave was and is connected to the quarantines, and that's 78% increase in domestic violence, a 44% increase in sexual abuse, increases in eating disorders, substance abuse, a bunch of things that are made much more difficult by being in quarantine. They may have existed before, or or maybe not, but there are things that are the product of being in quarantine. And we've just started seeing the third wave, which is grief. So a fourfold increase in grief, because with 84,000 plus people having died in the last 2 months, we're seeing more grief. The top two words we're seeing there are grandma and grandpa, and then connection to job loss. So the colossal job implications and the economic ruin is something that we're seeing, and we expect the grief and the job loss, depression, anxiety, the impacts of the quarantines, all these things to last for a very long time. So those are the issues. The people that we're seeing are really very interesting. Typically pre-COVID, 53% of our texters were under the age of 17. So because we're text, we skewed young. But now our primary age group, I think I'm talking to you right now, is 18 to 34. That is really who we're seeing. That's the bulk. And that's because it's been most disruptive to 18 to 34-year-olds. So, and it's been disruptive to them in three ways: their living situation, their career, and their relationships. So living, you're either sheltering alone, which is hard, that's 12% of our texters, or you've moved back into your high school bedroom, which feels like a defeat, or you have little kids, which is very difficult, or you're sheltering with roommates who you met on Craigslist and you never thought you'd spend this much time with them. So that's shelter. Your career, school, college, graduate school, your job, all that's been disrupted, and you're the first to be furloughed or laid off. And then relationships. I mean, dating in a pandemic when you're required to be 6 feet away and wear a mask. I don't, the jokes write themselves. I will leave that to the late night comedians and to your imagination. But yeah, the 18 to 34-year-olds are really struggling. Their adulting has just been disrupted. It's really hard. So, and then we're seeing more low-income people, like the very poorest people in America. 32% of all of our texters right now indicate they're from household incomes of under $20,000. Just a lot of people either in poverty or facing poverty. Yeah.
Thank you, Nancy. A quick follow-up question to that. Do you all track how people find the crisis text line information?
We do, and we were starting to see an uptick in first responders. And then credit to Taryn. Taryn reached out to us from Kate Spade and said, we think you guys should do an initiative just for first responders. And we were like, that's a really smart idea. And so credit to Kate Spade. Usually the charity comes up with the idea and then goes around like with a cup saying, please put money in our cup so we can do it. And it's pretty remarkable when you have a partner. Actually, funny enough, Harry's, you did this with men, so we can talk about that too. But it's very rare, so how weird that we have two of our sponsors on here who have each done this with us, but that they come up with an idea and say, we think you're missing something. So we launched a campaign called For the Front Lines, which you can go to forthefrontlines.org and see it. And it is for people on the front lines, essential workers. And now as much as 34% of everybody texting us says that they are either on the front lines or related to somebody on the front lines. So kids of people. And that has just been remarkable. And I'll say something, I don't know, I just find really heartwarming about that. Yes, they are concerned about becoming ill themselves. And yes, they are concerned about their jobs. But the number one thing that all of those people on the front lines are concerned about is actually infecting other people. It's pretty beautiful. I mean, these really are, they are heroes.
Yep. Thank you. Taryn or Maggie, I don't know if you all have anything to add about data or usage or the messages that you all send out on some of the initiatives you work on.
I don't have anything to add. I think Nancy really covered a lot of it. You know, we as a brand really turn to our key nonprofit partners who are on the front line to share that information with us. So nothing to add in addition to what Nancy shared.
Yeah, and I think for us, you know, we too were just leaning into what we knew. And then, you know, when you're thinking about how does your kind of company, you know, respond to this crisis, we could have done a lot of things, you know, and you see companies doing a ton of different things. But for us, it was important to lean into our existing partnerships and, you know, talk about what we know well, which was mental health. So for us, some of the things that we did were, you know, right after this happened, update our website. So now that we have our custom crisis text line number at the top of our homepage when you go to harrys.com, we had social media posts about reaching out for help with that custom line. Every time you reach out to customer experience now at the end of your email, you'll see the custom line. And then, you know, and then sending an actual email, which turns out was, you know, one of the highest performing emails that we've sent all year. And I think it's because people really appreciated just hearing that things weren't the same, and that we were leaning into existing partners and to what we already knew, and we'd already sort of like nailed that language on how to talk about this work. And so yeah, so that's what we did, and we saw an overwhelming response because we have that custom line with crisis text line. You can see on the back end exactly what that looks like. We know that, you know, our volume was up four times as much as it normally is. So that means that people need help,
Yep.
and we're happy to be able to put that line anywhere you sort of interact with us, whether it's on our website, whether it's email or social media, or if you're just emailing about your order, it's now going to be at the bottom of your order. So yeah, that's the ways that we sort of have been able to plug in. And I think for us, it was just this moment of just like leaning into something that we knew, we already knew. And for that is mental health.
Can I add here? Because this is not an obvious partnership. I just want to, this is not, and I'm really proud that we've now done more than 100,000 conversations. Like, we should get that number out there. It's more than 100,000 conversations that we've done with men on that Harry's keyword. So it's had a huge impact. But and we knew people at Harry's before and thought Harry's was an amazing brand. Again, Harry's came to us and said, we think we want to tackle mental health. And I was like, you guys make razors. This seems like a banana. Like, can we really do this? Because, you know, people sometimes attempt suicide by using a razor. Like, what? And it was not an obvious partnership. And I really applaud the courage and the careful messaging that Harry's has used, which has been, no, we're a men's grooming. We're here to help you be the best version of yourself. We help men feel strong and prepared to like tackle whatever it is they're tackling that day, which is mental health. It's getting your head in the game. And so, you know, we've agreed, like, razors don't appear in ads that we are in, and we don't do them side by side, which makes sense. And what I appreciate most is leaning into the hard things. I mean, a lot of times cause marketing is seen as like the nice thing, and then it only goes so far because it is predictable. Of course, everybody's going to do stuff that's pink in October. And it is predictable. We all remember the NFL doing something pink because nobody ever expected like professional football players to be wearing pink. It's the unexpected stuff that sometimes really drives these partnerships home. And so I really appreciate that about Harry's, and it's really gone very well. And by the way, P.S., like, the only way we're going to take down stigma, the only way we're really going to make strides in mental health is if brands and also individuals, leaders, take risks and do the stuff that's not predictable. So we're really proud of this partnership too, because I had to really think about whether or not to say yes to it. This was not obvious to us. And you know, again, kudos to you and to Jeff and Andy. It's super cool.
Yeah.
Thank
I feel
you.
like the journey to coming to working into the mental health space, especially whether you're a corporate or a nonprofit, or you're coming from like even the academic sector, you know, it's definitely, I feel like we all arrive here for different reasons. And speaking of pink, we love pink. We like pink a lot. And I feel like our journey, and, you know, Maggie reached out to me a year ago and was like, hey, like, let's start partnering more. You know, you guys are stepping into the mental health space. Like, we're really focused on men. You all are starting to, you know, focus more on women. And we were pretty quiet about our work in the mental well-being and mental health space for the first few years. We launched an initiative in Rwanda called On Purpose in 2012. And we actually incubated mental health and access to mental health into the women's empowerment work that was being done there. And so it was a kind of a combination of providing mental health and economic empowerment opportunities to women who were working in a supplier that we were sourcing handbags from. And we had Georgetown come in 2017 to actually study that work. And we found that women were actually reaching higher levels of empowerment because they had access to both economic empowerment and mental well-being service, versus if they just had access to economic empowerment opportunities. So we started there, and then when Kate passed, it'll be 2 years in June, that's really when I would say we deepened our work and really made mental well-being a key cornerstone of how we were going to support organizations, as well as, you know, structure things internally for us at Kate. I think a big part of this too is like, and I think this is becoming really, really important for corporate social impact teams, CSR professionals, is what you're putting out in the world has to be reflected internally. And, you know, so that's been something that's been really important to us. And I know, Maggie, we've chatted about that as well. And with Nancy, you know, we've had some of our store associates sign up to be crisis counselors. So it's like, it's really important to kind of balance those two things too. I think especially in this space, almost more so than maybe some other societal issues that companies will tackle, because your insides need to match your outsides.
Yep.
Yeah, and I, oh, go ahead, Taryn.
It was Maggie, I think. No, I was just going to say some of some other challenges, like some things that we talk about a lot. Like these weren't easy conversations to have with our leadership, like these are like very challenging topics. Like first and foremost, like we've sort of hinted at around this, but like mental health can be dark. Like as a brand, do you want to be able to talk about suicide? As a brand that sells razors, can we talk about suicide in the world? Like that's like a pretty big thing to take on. And so that's something that we definitely like had to talk through and make sure that we were comfortable doing and really sweat the details on how we communicate it. Like for us, like we're talking about men. And like men are generally just not like the most like sympathetic. They experience so much privilege, so it can be really tricky to talk about men. You don't want to come off as saying like, well, what about men? Like that's just not the tone that we wanted to take. Also for us, like another challenge is just like the impact and measurements. Like it's not, Nancy and her team do this so well, but they're far beyond, I think, what we're thinking about in terms of like measurement and evaluation and impact. Like I used to work for an education organization for years. I probably had in the back of my pocket hundreds of metrics on each individual student. This is not the same in terms of mental health. Like how are you making a difference? Or how are we making a difference as a company? Like, or is it like, the lack of death by suicide? That feels too bold. So you really have to sort of work through the impact there. And then like lastly, what Taryn was saying, like that is a very real thing. I personally think it's hard to be a company right now and be ahead of the curve in terms of providing your team mental health. Like it's a little bit elusive. There's no one playbook where one company is saying like, we've done this, or even you talk to Nancy and she works on that internally with her team all the time too. Like we're a mental health organization. We really have to we have to be the best in class internally for our team. But what does that even like look like? And so I think for us, we had to do like a really like honest gut check here. Like, how do we deal with this with our team? Do we feel like they feel supported in terms of their mental health? Like, does our actual insurance cover mental health? Like those are the types of questions that we had to ask ourselves. And we luckily, felt like we were good to go there. But also has like really pushed us to think more about it. Like we could be doing more. We could be providing our team much more in terms of mental health than we do right now, which has been a really cool sort of result of like focusing on something in the outside world and making it change some of our policies internally.
Yeah. Yeah, no, it's great to hear you all say that. I think, Taryn, when you were talking about how this issue is one of the social issues that is unique to both sort of the community and the internal strategies and initiatives that a company addresses. I've been working with dozens of companies on issues, and this is one of the biggest. And we consistently say that a company and an organization is either doing one or the other better. Either their first focus has been their community impact work around mental health, or their initial focus has been strengthening their internal protocols and addressing mental health and really working towards shifting stigma. And then we're now at this time where a lot of organizations are coming to this place of, wait a second, how do we balance both? And how do we truly walk the walk? Because we know at the end of the day, we've all come to this in different ways, oftentimes through personal experiences. The statistics are 1 in 5.
Right.
And so those are real. And so, but it is a challenging conversation, and you all touched on some of those challenges a little bit, and you guys took this on years ago before a crisis, before it was the topic that, was hitting headlines every day. What are some of the lessons that you've learned through that process? Because certainly I've seen how conversation has changed, and people go through these aha moments and you see their reactions to crisis, and you realize that we have such a long way to go. And so for organizations on the line, I know they'd love to hear some of the lessons learned, and I'm sure it's a learning. It's always learning and always asking questions along the way.
Yeah. I can start with that one. I think the first thing, and before I actually came to Kate, I was at the chamber for a pretty significant period of time, and I left that job really understanding the importance of cross-sector partnerships. And I've heard so many people, whether it be at panels that we hosted or dinners or in newsletters, like the importance of partnership. And I have to say, now being on kind of this side of in the social impact space, in the corporate side, like having really strong partnerships really matters. And it's not just about grants, it's about ongoing conversation and dialogue. Like, I can't tell you the amount of times that Nancy's team has reached out to us about stuff that has nothing to do with our partnership. And in some ways, like, it's been so incredibly helpful. And I could say the same for partners, for a lot of our partners in this space. I think that that's super, super important, is really getting to know the players and the partners, and just really becoming a member of the community in a meaningful way. I think that that's incredibly important. I mean, I used to exclusively work in the women's economic empowerment space, and I would actually say the mental health space, it's even more important to have a strong community, because also, I mean, like, if you have experienced or triggered it anyway, it's important to be able to call somebody up and talk about it, and I think that that's really important too, because these are such sensitive topics. So I would say the community piece is huge. And then the second thing that I think has been really, know your like, I think for us, how we talk, I guess, don't steer too far from what your social impact vision and mission has been. I think for us, we definitely, mental health and mental well-being is at the heart of our women and girls empowerment work, but we also fund initiatives and focus in women's and girls agency and economic empowerment and community. And those are also really important pieces. And we really are trying to take a holistic approach to empowerment. And so, we have still remained consistent with other issues that are particularly relevant for women. And I think that that's really important too, to really ask yourself, is this the right issue for us to step into? And if so, how? And how do we stay true to who we are as an organization, who our customers are, and who our employees are?
Great, thank you. And I think what's interesting about the topic of mental health is, in one way or another, it weaves in to every corporation's people and mission, and it's not, and it connects to everything from inclusion to health to education. And so sometimes it's just about stepping outside the box and getting creative about what that core business is, and how this issue can align in a way that feels like it elevates the brand and it's true to the brand as well. Mm-hmm. I want to stop for a second because I'm peeking, and there are a couple questions that are coming in that I want to make sure we address. So one question is about broader demographics and various socioeconomic status, and how your organizations, from Crisis Text Line to the brands, are ensuring that you're really reaching a broad audience. We know that probably your brands and your customer base is probably pretty specific. And so there are some questions around that, if anyone wants to take that.
I could probably start.
Go ahead. I was just going to say, because it's text, it's incredibly diverse. I mean, so like that's the medium is part of the message. So because it's text, we skew young, poor, rural, and diverse. So young, I already mentioned, 18 to 34 is our biggest sweet spot now, but it used to be under age 18, and that's still our second largest sweet spot by far. Poor, I talked about those numbers too. Rural, and then diverse 19% of our texters identify as Hispanic, 12% Black, 5.5% Native American, which is really fascinating, and 44% LGBTQ. So we are
44?
already 44.
Wow.
Yeah, strongly LGBTQ. So we are reaching marginalized people. We are reaching people who don't feel heard other places, who don't feel like they have access. And because it's text and it's in their pocket and there's a veil of ignorance, so I don't see their faces like we're looking at you. I don't see, we don't hear a voice. So, you know, you could be talking to a 13-year-old girl in Kentucky or a big burly lumberjack man in Montana. You don't know. And that's what a veil of ignorance does, is it helps reduce bias and makes us more broadly appealing.
Yeah.
Excellent.
For us, you know, when we were looking into focusing in on mental health, it was important for us to answer that question. Like, how do we actually get to the folks that need help? Well, first and foremost, we're a men's care brand, so that was sort of like part of our evolution and our social impact was we actually first were focusing on giving to organizations that were promoting positive masculinity, but I wanted to go like a little bit deeper here and figure out like what is a cause area around this? What is something that we could own? We went back to our partners. Overwhelmingly, they were like mental health. You know, like this is just the challenge for men right now. And so first we got there, right? That was like step one for us. And then it was really trying to understand what are populations that we can serve that are disproportionately affected by mental health, that are mostly men or over-indexed for men. So, so for us, it's veterans first and foremost, due to 25 or 22 veterans die by suicide a day in this country, which is like a conservative estimate. We also, LGBTQ folks, as Nancy mentioned, our Pride campaign, it's launched at the end of the week, which goes back to the Trevor Project, is another one of our nonprofit partners there.
Great. They're awesome. Trevor Project's great.
Yeah, so they've been like fantastic partners to us, and just like elevating this conversation during Pride around mental health, like, and why that population in particular is affected by mental health, which has just been like a really cool moment for us to lean into our social mission rather than just like rainbow washing. So LGBTQ folks, veterans, young men in the US in particular, it's the second killer of men under 39. In the UK, it's the #1 killer under men under 45, which we also operate in the UK too and have partnerships there. And then in the UK in particular, we serve those experiencing homelessness. And in particular in the UK, it's like a different scenario, homelessness, and the average age of those who are experiencing homelessness, over-indexing men, and over 80% of them are experiencing a mental health crisis at the time of when they're experiencing homelessness too. So for us, it was really trying to find those like populations and make sure that all of our nonprofit organizations like somehow ladder up into that, because it is important. For us, again, we're serving men, which I think at first glance you think they experience so much privilege here, but as you dig deeper and understand the sort of research, you'll realize that this is an issue, and that we felt like we could talk about and own by focusing on those particular communities.
Can I add one more thing? Because I love, Taryn talked about knowing the space, and then Maggie mentioned the Trevor Project, who I also love. I love Amit, who's the CEO over there, and we've worked with lots of, I have 3 former staff who actually work there from Do Something. But anyway, and that's what's unique about the mental health space. I don't feel like we have any competitors. I'm thrilled that you're also funding the Trevor Project. Everybody should fund them. I don't feel like we have any competitors at Crisis Text Line, but I do feel like we have an enemy, and the enemy is stigma. And that's really what all of these campaigns are doing. Stigma is the enemy. That's we need to name this. We haven't explicitly said this here yet in this conversation, but mental health has been a hard thing for companies, both internally and for their brands, because there's fear and shame associated with it. And so people have dipped a toe in the water and sort of called it well-being. And this is a moment to stick the whole foot in and to talk about mental health. It's beyond well-being, and it really is. It's mental health, and probably you, definitely your employees, absolutely your customers. I mean, the world is feeling pretty funky right now. So to call it what it is, this is a wonderful opportunity right now to reduce the shame, reduce the fear, because shame and fear, of course, lead to silence, inaction, very dire things. This is a great moment for taking on this issue, and you should do it with multiple organizations.
Great. Well, everyone's talking about multiple organizations and partners, and we all know that we can't go at any one issue alone, and identifying and creating the right partners and the right partnerships is certainly key to impact. So I want to kind of dig a little bit deeper. We're showcasing a beautiful partnership, and one that is certainly unique. It doesn't always, it doesn't always work out this way. I would love to hear from both sides on what you look for in a partnership and what makes a partnership successful, because certainly the private sector goes into a partnership with one set of, of goals and objectives, and a nonprofit partner has another set, and everyone's bringing different things to the table. So can we talk a little bit about how to build the right partnership, and quite honestly also what happens when a partnership isn't right, and that happens too.
Maggie, this is kind of like dating advice that you were getting to at the beginning.
The number of times that I have compared this to dating is remarkable. I actually have, I think, a flow chart internally that I show leadership about. This is our dating phase. This
I love this.
Truly, the analogy is really helpful. I guess I can start a little bit and say, I'm mostly curious for what Nancy has to say, honestly, on this one. But I think for us, I came from nonprofit. I worked 15 years in nonprofit. A lot of my background is in corporate partnerships. So I was doing the work with that many of the contacts that I work with do every day. I personally feel like, for us, it's first and foremost impact. If you can't prove your impact, there's just no interest in partnering with you. You can have a lot of impact in the world too, and it just doesn't ladder up into the impact that we're trying to make. Again, like dating, right? Like it's not about you. It's just like trying to find the right match. Really, we can take this really far, but I'll try not to, because it might
keep going. I'm following.
Like taking notes. But yeah, I think like for us, it's like the impact first and foremost. If we want to reach 500,000 men, there's only a certain amount of partners that we can actually do to make that happen. So make sure that they get access to mental health care. So that's us finding the right fit. I would say what's important to us, and what has always been important to us, is 1% of our sales that goes back. Always, if you purchase something at Flamingo, if you purchase something at Harry's, 1% of it goes back to nonprofit organizations. And for us, like, if we're going to partner with an organization, we're going to give them money, and we're going to give them a significant amount of money. All of our partners, we're one of the top corporate funders, and we're really proud of that. We want to significantly invest in your organization. We're not taking on hundreds and hundreds of partners for a reason. One of which is there's only one of me, and that wouldn't make much sense, but we really do want to focus our impact. So I think, like, that's something that comes to mind for me, but also just like generally, do you want to work with this organization? It does feel like a marriage at times, that you are stuck in it. So are they people that you want to work with? Is the impact that you want? Also, can you take it a little bit further beyond the investment? So for me, it's important that the investment is there. But can you find opportunities for our team to get involved? Crisis Text Line is a great example of this. We have folks on our team that are crisis counselors. I was just looking at someone's calendar today trying to book something. I saw they had a CTL shift, and it made me smile. That's awesome, in the middle of the day, because our team gets 5 paid days to give back to organizations of their choice. And a lot of them have decided to go through the training with Crisis Text Line and are now counselors. So how can you take it a little bit further and push it? How can you try something new? How can you be open to new ideas? We're risk takers. One day I called up Crisis Text Line and was like, hey, can we try doing ads for our number and see if that impacts like the number of people reaching out for help? And can we target like certain populations? Can we see if we could get more men to reach out for help? and they were game and they did it quickly. And that for us, that's like really important, to be quick and nimble and just like be able to shift really, really quickly and fast. And then, yeah, keep on taking it further and further and further. Great. Can we do empathy trainings together? Can you bring it to our team? Nancy, can you come and do a fireside chat in the middle of Mental Health Month? Yes, like all of those things I think go a long way for us. But I do think, coming from the nonprofit area in me, like first and foremost, like put some skin in the game and donate what you can as a brand. Yeah.
I mean, I've been married a long time, but I'm digging the dating metaphor. I mean, if I can remember back that far, I'm digging the dating metaphor, because you don't want to be one of many girlfriends.
Yeah.
And so it's really nice when someone's like, I'm all in on you. And that feels really good. So we know that we're special to both of you guys, and that matters to us. And so you get the CEO's time. And when you have an experiment, we're like, yeah, let's try targeted Facebook ads. Let's see how this works. And when you have a new idea for the front lines, we're like, cool, let's do it. So I think to have that that ongoing relationship at a real level, like at a significant funding level, but also like we're all in personal level, like talk often. And I think that's one. So it's like, be exclusive, not be exclusive. I want you to fund other things, but like date us meaningfully. Like I would say that's one. This metaphor is horrible. I would say another thing is I'm a big Brene Brown fan, and I think clarity is kindness. So I really do think being explicit, like, here's what I need, here's what's going on with my management team. Like Taryn and I have talked about this, like, here's what's going on. You just need to know, here's what's going on at Kate Spade right now. Here's what's going on with our company right now. Here's what's going on in the world. And for us to say, like, here's the data, to have a charitable partner who can be really clear, like, here's what's working and here's what's not. For me to be able to say, I am not comfortable with your razors. For me to be able to say, like, Taryn, we had a different keyword originally for the front lines, and we changed it to frontline because we knew it was going to work in the UK also and other places. For us to be able to say, this is the honest truth, or we need to hold back the launch for a day because, this is what's going on with TED, and I've got no control over TED, but to be able to say those things, that when a charity is so agreeable that they're just saying yes to everything and smiling and telling you everything is perfect and they love you, they're not being honest. And much better to date somebody who's going to be honest. So clarity is kindness. And so you got to be able to have those real conversations. And if you're coming from the same place, it's not like an us versus them. We're on the same team. We all want to help more people. We all want this to be as big as possible. We want these brands to be out there championing mental health and being rewarded for it by customers. Fine with all of that. That's great. As long as everybody's on that same page, then when you're having a conversation, it's more like two people on the same team talking about how they can get the ball further down the court rather than two opposing teammates fighting over where the ball goes. And now I'm going to sports metaphors, so I'm going to mute myself.
I follow those real well.
Great. I want to touch on a question that came in, Nancy, and this is for you. And certainly, if it's not one where we have answers for right now, we can always follow up. But you mentioned that grief was one of the biggest areas right now, and some folks are wondering how you're leaning into that in terms of the crisis text line's response to individuals experiencing grief.
So it has increased fourfold. It's not one of the biggest areas. It's only about 4% of the conversations that we see, but it's typically only 1% of the conversations we see. So that's a very large increase. I mean, grief is hard, especially right now when typically you would grieve someone in person. You might sit Shiva or go to a wake or do something in person. And now that's not a healthy thing to do. So all of our traditional coping things have been thrown out the window. So we do the same thing we do in all of our conversations. This is something that's really beautiful about Crisis Text Line. We like to say Lin-Manuel Miranda was right, and love is love is love is love. And so no matter what the issue is, our people are really trained to handle whatever comes their way with validation and active listening skills and collaborative problem solving. I can share with you a couple of things that work for grief. So there are some referrals that we give to people that are quite good. modernloss.com is a great website. We also send people, in fact, our former head of comms, who I think both of you know, Liz Eddy, actually left Crisis Text Line to go start something called Lantern, which is a startup in this space. She lost her father when she was 10. And so she's built like the all-in-one place for when people die. We ask people to remember what makes them feel strong. Right now, what we're seeing in this COVID period, this is beyond grief, but everything, people are really turning to three things: family, friends, and pets. So family, mom is outpacing dad 2-to-1. I will just say everyone wants their mom right now. Friends, the word reconnect is trending really high. People are reconnecting with that friend from middle school, that person you had a falling out with, that ex you haven't talked to in years. And pets, dogs are outpacing cats, but everybody is really finding solace in their furry friends right now. So not being alone, feeling connected to others.
You know, just building on that, even from, I mean, if you look at our social right now, there's, you know, we have some really cute photos of cats, and they are so heartwarming and loving. And like these animals really do just make you feel so good and warm and taken care of. And they bring you so much joy. They really do, in person and online.
Karen, if you want to do even better, go with puppies. Dogs are outpacing the cats 2-to-1. So I get it, but like, you're going to have more love with the puppies.
With the puppies, yeah.
So we have a question, which, you know, I'm also happy to take here on what can government, states, federal, state, local, learn from private sector companies and, you know, nonprofit experts and industry experts about how to better brand mental health and suicide prevention, and are there best practices on messaging. So this isn't even just about, you know, what can they do in terms of fund stronger healthcare systems, but really how can they help shift stigma through conversation and messaging and all of that. Great question.
We like to say that 100% of people have mental health. Everybody has mental health, just like you all have dental health. And sometimes you need to see the dentist, and sometimes brushing on your own is fine. And everybody has mental health. And so I think normalizing it like that. You might also notice that I'm not particularly wah-wah. I mean, I'm a happy person, and the team that I work with are happy people. And you'll see our brand, we can do serious, and it's very serious subject matter, but we don't take ourselves too seriously. We like to find joyful moments. We like to celebrate. And I think that just because the subject matter is serious doesn't mean that all the messaging around it and the campaigns need to be like Enya playing in the background, making you weep. And I think this social good stuff, we should find joy.
I connect with that so much, Nancy, just in terms of, I think the sentiment in the voice, and it doesn't have to be a scary topic, because that's also what keeps people away from engaging in it, you know. And I think specifically to the question about like government, you know, I think that, I mean, I mentioned this already in terms of the partnerships piece, but I think, you know, government partnering with nonprofits who have experience in their states or in their specific areas is super important. And the chamber actually connected us with the state of New York and Governor Cuomo's office. And for the front lines, the partnership with Crisis Text Line and Kate Spade was then also part of Governor Cuomo's press briefing on May 1st, which got that number in front of the eyeballs of thousands of more people. So, you know, I think that there's also, I think that government, definitely the partnership piece for government's important. And also just, you know, they also have the regionally specific knowledge of what's going to work in their state or in their area. And so that's also a really important element too, whether it's a keyword for Crisis Text Line or, you know, I'm from Pittsburgh. And there's certain words that you would use in Pittsburgh and that you wouldn't use in Pittsburgh, because that's either going to make or break the conversation. And you need to know that. And we actually have a pretty thriving mental health community in Pittsburgh. And when I hear some of my colleagues, from the Pittsburgh area that talk about mental health, they use different words, and it's because those words resonate with that community. So I do think language is also really important in making sure that it really hits the right tone with those you're looking to serve.
That's great, Taryn. And we, for everyone's awareness, we have several questions really around the marketing and the messaging. And I think this is something that's relevant on a range of issues. I can think of many issues that I've worked on where the marketing is so important for the behavior change, and it's just like product marketing, and we have to understand our audience. We've done a bunch of research as well at the Chamber Foundation in workplaces, and another tidbit that we've learned is that employers really vary in terms of how they talk about it internally, and they're looking to their employee base to learn what language resonates the most. In younger populations, mental health is talked about. It's sexy. It's, everyone's talking about it more freely. And this is a bit of a generalization, but older populations, there is a much stronger stigma, and it is covering it up and using words like wellness and well-being. And so I think to answer that marketing and messaging perspective, it's just really critical to know who your audience is in each place that you're talking about this and with all of your initiatives. And it may be that you have a different set of materials and messages depending on who you're marketing to. I don't know if anyone has anything to add. I'm seeing head nods. And
I do. Yeah, I want to jump in on this one because I'm grateful that the rising generation are champions of mental health. I really am. I mean, thank goodness that the world is changing. I think it's great that companies are listening to their employees, but I think leaders need to lead. And if they're afraid to talk about this, then they're actually going to make more stigma. And so I think leaders, I actually just got an email while sitting here, the Chief Communications Officer for Mental Health America is watching, who is, leading a lot of this. And I think leaders need to lead, and the tone can't be apologetic or tiptoeing around things. There ought to be pride. The way you're seeing Harry's and Kate Spade talk about this, we need more companies, and whether they work with Crisis Text Line or Mental Health America or Trevor Project or Summit, I don't care, but please get involved in this issue and lead. We need our leaders to say 100% of people have mental health. This is something that we care about for our employees. This is something we care about for our customers. This is something we care about for our country. For those political leaders you asked about, Elise, some things can't just flow with the tides. You actually need to make them happen. And this stigma that's existed for a long time is kind of unforgivable. People are dying, and those could all be prevented if we made it easier for them to come forward. What a waste. And so if we could make it easier for them to come forward, everybody can actually do their part on this one, just by getting comfortable talking about mental health, just by reducing that stigma. So I'm all for the rising generation. I'm all for listening to your employees, but I think, and it isn't a hard thing to do. Celebrate it, find joyful language, be cheeky about it. It's okay, but we need to wade in.
Yeah, no, Nancy, that's great. And I think, we are constantly talking about the storytelling piece and the leaders that need to take this on if we really want to see real culture change. And for the folks out there that are sitting on the other end of the line, nodding and wishing that they could help build that case and help get the leadership within organizations to talk more openly, do you have tips for organizations on the other end? And I will say, we work with so many companies, and right now has been a time where everyone's been more vulnerable. And so it's sort of, if not now, when, and now is truly that time where everyone is impacted. And it's the silver lining in this, that it is a nice setup for leaders to talk about things that they may otherwise not have talked about. So any other tips for having that conversation and bringing leaders along?
I mean, I would just add that, like, I don't know if there's like too much of a tip here, but like now is the time where you could really get in. Like, let's use this for what it is. Like, it's hard. I think it's impossible to have, if you're a leader right now and be talking to your team and not be somehow referencing mental health. Like, so dip your toes in right now. Like, now is the time. Push your team if you've been thinking about taking this on as a cause area. If you just think that your leadership has some interest, like, push them to dive in a little bit deeper. I think, like, our team, like, we haven't had a team meeting where Jeff and Andy haven't openly talked about how they're feeling and how tough this is. So much so that we've implemented time off for our team. Every time we're working remotely, you get, or every month you were working remotely, you get 2 days off a month. It's a mental health moment. You know, this is the time to those small, like, little things that you can be doing as a team, like, dip your toe in now, before I think we go back to the norm and then this is hard again and you're gonna have to be building your case. That's just my advice would be, like, take advantage of this time right now.
Yep. Yep. And I think I speak for all of us when I say that this is a time where we hope that we are now having a moment where there will be a long-term conversation, and that COVID-19 will really have catapulted this issue to the place where it should have been for a long, long, long time. So, so thank you all so much. I want to close with one last 30 seconds from each of you before I just wrap on some housekeeping things, which is, what are each of you doing to support your mental health in this quarantine time? We had some informal conversation before the webinar started, but anything that you would love to share with everyone on the line? Taryn, I'll start with you.
Oh gosh, okay. Okay, I'd say probably, I personally, my mental health journey really started 3 years ago after I lost my mom. And so I started kind of putting these new practices into place. And I think with quarantine, something that's been challenging is you don't have the same access to, I live in New York City. So, like, the places that I would go are closed or, like, aren't open right now. So I think the first of which was, like, initially just leaning into the virtual access to whether it be meditation. I really like doing the class by Taryn Toomey. That's been something that's been really helpful for me. And then I haven't been doing so great on that the last few weeks, but I think the thing for me too, Maggie, I also live by myself. And so I came out to be with friends the last few weeks, and that's been really great to just be in community with good friends. And I think the third piece that I'll share in terms of taking care of myself is, this is gonna sound so silly, but it really, like, I started taking a probiotic. And when I take that, like, little probiotic in the morning, I'm like, okay, I'm doing something for myself here. And I'm, like, saying, to my body, like, I'm really valuing you this morning. And it sounds so simple, but, like, I've been wanting to do that for years and I haven't done it. And, like, just doing that every day has really been, like, a little love tap to myself. And that's been really nice.
I love that. Thank you. Nancy?
Well, on the opposite end of the spectrum, I'm going to come out of the COVID-19 with an additional 19 pounds for sure. I'm just eating all the sugar. So I'm just, sugar is my friend right here. And then I've also taught my teenagers to play poker, and we've been playing family Texas Hold'em tournaments, and I have been ruthless and I'm just crushing them, check raising, putting them all in. And we've had 5 tournaments. I have won 5 times and I feel no remorse, no regrets. There have been tears, and poker, it's the arena. There has to be a winner. And it feels really good when I do empathy all day to just crush my family in poker, basically.
Love it. And Maggie?
I'll be really quick because I know we're at time. Taking time off. I think if you worked in the social impact space or work in nonprofit right now, your world has been flipped upside down. You've probably been working more hours than ever. I actually take time off right now. I don't care if there's no place to go. I'm just not going to work. So that's the first thing that I've been doing, and taking these mental health moments that Harry's has provided. But also every Thursday in May, our Flamingo team on our Instagram is holding some like mental health moments with one of our nonprofit partners, which is called Exhale to Inhale, which brings trauma-informed yoga to survivors of domestic violence and assault, and is doing it for our community. So if anyone wants to join me, Thursday, 6 o'clock on our Instagram, on Flamingo's Instagram.
Wonderful. Well, thank you all so much. We could talk forever, I'm sure. Today's discussion was part of the Chamber Foundation's Mental Health TeleTalk series. So we have a series of conversations that have been going on and will continue to go on that are really focused on all facets of mental health, well-being, and community building to help businesses in their role as corporate citizens, as employers, and as individuals. Our next one will take place on May 28th. You will receive more information about it. And as a reminder, today's webinar was recorded. We'll send the recording out with my follow-up note. And we hope you enjoy the rest of your day, and be well, everyone. Thank you.
Bye, all.
Bye.
Bye.